poorest areas in England have seen disproportionate cuts to public health spending. The Institute for Public Policy Research says these regions have also been hit hardest by the coronavirus pandemic, with poor underlying health contributing to a high death toll. The study shows that England has seen public health spending cut by an average of just over £13 a person. But in the Midlands, it's almost £17 per person. And the worst affected area is the northeast of England, with spending cuts of more than £23 per person. Our health correspondent Dominic Hughes reports from Gateshead.
In deprived communities like Bensham in Gateshead, poor housing and a lack of jobs are feeding ill health. Cuts to public health projects targeting smoking, obesity or addiction haven't helped, so people are having to find their own solutions.
Sorry? Yeah.
For the past decade, Charlie Dixon barely knew his neighbours in this sheltered housing project. But that's all changed with the start of a free food hub, ending isolation and loneliness.
I've been here all these years. I didn't know anybody. You know, not even on my floor. You wouldn't say hello to, didn't know the names. Now I know all the names, you know, and everybody comes out and says, hello Charlie, or hello Fred, you know, it's great, it's fantastic.
Building strong, resilient communities is a powerful weapon in the fight against ill health. But new research shows how it's the poorest parts of England that, since 2014, have seen the biggest cuts to public health budgets, undermining that work.
Well, that cut has led to the reduction in some of those really important programmes that get to work on the things that cause ill health. So programmes like drug and alcohol reduction and things to help reduce rates of obesity and smoking.
These are also some of the conditions that leave people more vulnerable to COVID-19, a deadly combination of poverty and underlying ill health.
We know people from our most disadvantaged communities are more likely to be working in frontline occupations and therefore exposed to COVID. But we also know they're more likely to have the underlying conditions that make them, have an increased risk of severe form of COVID and sadly death.
As the health gap between rich and poor widens, charities like the Comfrey Garden Project are stepping in to help the most vulnerable. People like Hussein, a refugee from Iran who's developed new skills and friends.
You can imagine how difficult it can be when you are in an area you don't know, you don't have any friends or family, and also you cannot speak the language other people speak. But I find a job in this project, they offer me a job, so we can see how different my life can be with Comfrey project and without Comfrey project.
The Department for Health and Social Care in England says more than £10 billion has been provided to help councils cope with the pandemic. But the coronavirus has only highlighted pre-existing inequalities in health. Today's report is a reminder that once the virus has faded, those inequalities will remain. Dominic Hughes, BBC News, Gateshead.